When we do a surgical procedure, what we do is that we take a speculum. The speculum is an instrument that most women know when they go for their pap smears. We introduce the pap smear into the vagina, and it allows us to visualize the opening of the cervix, which is what women would ideally call the womb. And then we do a manual vacuum aspiration where we remove the pregnancy. That is why it's called surgical, because it's more of a procedure, unlike the tablets where it's more of a process. If their pregnancy is less than 9 weeks, they can have the pill. There are women that I'm 6 weeks pregnant. I cannot take my medication home with me. I live with my whoever they live with. I don't want them to be aware that I'm undergoing this process. I need a procedure where I'm going to come to the facility. Everything is going to happen in the same day. And in those cases, we then provide the surgical termination of pregnancy. At Maristoke, South Africa, we do offer the option of having it done under sedation, or conscious sedation. That's where we give you medication for you to be asleep. With conscious sedation, it's very different from when you're going for like a hectic operation. If I had to tap on you, say your name, the patient would respond, but they're not fully aware of what's happening around them. So it's just a procedural sedation. We take the client to recovery. We need to monitor their bleeding to make sure that they're not bleeding excessively. We need to make sure that their vital signs, their blood pressure, their temperature, their heart rate, their respiration rate, it's normal or within the normal ranges that exist. And then once she's comfortable, she's good, we assess and then we discharge. So after the procedure, you are going to be in discomfort. Remember, as the procedure is occurring, your uterus or your womb is getting empty. And because it's getting empty, the womb itself starts to contract. So those contractions, you would feel them as lower abdominal pains. There is going to be bleeding. However, obviously we don't want the bleeding to be excessive, so we also monitor for that. The medications, the misoprostol that we use for priming, they do have some side effects. The most common one is shivers, feeling hot and cold. So with surgical procedure, it is a same day procedure, even though it can take the whole day. But ideally, women come in the morning and by the afternoon, they get discharged. With our conscious sedation procedures, 12 hours after the procedure, you're not allowed to drive. So we do advise women that they need to arrange for transportation. But if you're doing the procedure without sedation, you would have been discharged in a condition where you would be able to drive yourself home. At Maristoke, South Africa, if you're on medical aid, we're able to call the nearest private hospital. Usually we discuss with the gynecologist on call, the same with our public hospitals. If there are any complication, you need to be referred to a hospital, we contact our ambulance that then transfers you, and that cost is settled by Maristoke, South Africa, and not the client.